I'm Jan Blonk, and I will be the moderator of this morning session before the break, and I will take you through this session. First of all, we would like to start now to begin with the session today. First off, we have a presentation from Gethin Thomas from MND Australia and Beck Sheean of FightMND on the Australian Summit for MND Research, a collective impact approach to tackling MND. It's late in the evening, so we start with Australia. Up to you.
Hi, I'm Beck Sheean. I'm the Research Director at FightMND.
Hi, I'm Gethin Thomas, Executive Director of Research at MND Research Australia.
So I'd like to thank the organisers for giving us the opportunity to talk today about our Australian MND Research Summit that we've just run. I'll just share my screen. Okay, so just to give a bit of background about MND in Australia. So there's estimated to be over 2,000 Australians living with MND in Australia. And we have 10 established MND centres that exist across Australia, with each clinic seeing between 50 to 350 people. Within Australia, we have a number of MND organisations. There's MND Australia, and underneath MND Australia, there's the state associations which represent each state in Australia, and also the research arm of MND Australia is called MND Research Australia, or MNDRA. And then we have a number of Australian charities as well, with FightMND being the largest MND charity in Australia. So a bit of background about MNDRA. It's the research arm of MND Australia. It was established in 1984 as a national organisation promoting MND research. They offered their first grant back in 1988. In 2010, it amalgamated with MND Australia. And to date, it's supported over $40 million of MND research. So FightMND is an Australian not-for-profit that was established in 2014 by these three gentlemen here. So Pat Cunningham, who lost his wife Angie to MND, Dr. Ian Davis, who was a cancer doctor who lost his battle with MND in 2018, and Neil Danaher, who is one of the founders of FightMND and also one of our major ambassadors. Here he is wearing our iconic FightMND blue beanie. So FightMND is primarily a fundraising organisation who raises money through grassroots fundraising and some big campaigns, including the Big Freeze. So FightMND has committed over $48 million into MND research in the last 5 years, and close to $5 million into care through the purchase of assistive equipment to support people living with MND. So MNDRA and FightMND are two independent organisations that work independently of each other or fund research independently. So MNDRA primarily funds discovery research through innovator grants, whereas FightMND funds clinical research through clinical trial and drug development grants. And both organisations support the MND sector and capacity building through PhD scholarships and fellowships. So between the two organisations, over $85 million has been invested into MND research, with over $60 million invested in the last 5 years. So we've had more funding than ever before in the sector, and that comes with a responsibility to people with MND to make sure that we're using these funds as effectively as possible. And it also offers a really unique opportunity to change the way that we do research through big investments and working together. So Gethin and I got together and we started to ask what kind of impact our research investments were having on people with MND. So we started to ask questions around how can we have more impact? What are our priorities, and are these the same as people with lived experience of MND? Where are the gaps? What aren't we funding? What aren't we supporting? How can we work better together to have more impact? And how can we engage better with people with lived experience to ensure that we keep them at the centre of our decisions? So in order to answer some of these questions, Gethin and I formed a committee, a summit committee, with representatives from across the MND sector, so researchers and clinicians, industry, and people with lived experience. We also have a person on the committee with a unique experience who's a world-renowned MND researcher who also is living with MND. So the committee met for the first time together at the International MND Symposium in Perth last year. And the consensus from the meeting was to host a MND Research Summit to answer some of the big questions and to drive a research agenda. So as well as the committee and FightMND and MNDRA, we formed a partnership with PwC's The Impact Assembly. And the Impact Assembly is a social venture designed to enable collaboration for social change. They've got experience working in other research sectors, including obesity and MS research. And the partnership with the Impact Assembly was really important because they could act as neutral facilitators so that any biases or wants or needs of each individual or each organisation was put to the side, and instead focus was on a common agenda and a shared goal. So the next step after the meeting in Perth was to host a Discovery Day. So Gethin, myself, the Summit Committee and the Impact Assembly came together for a virtual Discovery Day in June to really workshop what we would want the summit to look like and what outcomes we wanted to try to achieve. So the main objectives were to form a collective, and by forming this collective would shift from having an isolated impact to a collective impact. And what this really means is a collective impact initiative is a long-term commitment by a group of stakeholders from different sectors throughout a specific area to work towards a common agenda for solving a complex problem. So the outputs from the Discovery Day were to ask the questions or answer the questions: what does a good integrated research strategy need to include? Who do we need to have as part of the discussion? And also, what does the summit design look like? And so to go into this, I'll pass over to Gethin.
All right, thank you, Beck. So to put the summit together, we really needed to have a smaller team to do that. So we put together what's called a design team, had about 5 to 6 members plus myself and Beck in this team. So the design team worked across about 2 months from September to November. We had about 5 meetings during this time to really get the summit planned. So our core roles were one, we had to define the scope and the givens and the objectives for the summit. We also wanted to draft a purpose, vision, and 10-year outcomes for this summit. So it's no good going in there for only 2 half days with a blank sheet of paper. We need to give some draft material to work on. We also then had to identify who we're going to invite to the summit, what we're going to discuss, and what other external inputs we might have. We also realised that we need a really good input from the Plex community. Obviously, we couldn't invite the whole Plex community to the summit, so we ran a survey across the community to answer some key questions about research, which I'll talk about in the next slide. Who was on the design team? We needed to bring in people with different voices and perspectives. They had to represent the breadth and depth of the MND research system. They also had to be individuals who will speak up, challenge, and contribute to this process. We don't want wallflowers. And also they have to be open to new ways of working and working with the PwC system. And that we needed their time commitment. It was going to be 10 hours over 6 to 8 weeks. Next slide, please. Right, so the survey, we went out to the whole Plex community through the various channels that we have, and we had 123 respondents. The questions we asked were basically, where do you live, and is that a regional or a city area? How are you connected? About 60% of our people were family or friends, with 13% people with MND. What level of involvement with research have you had? How would you describe that experience, positive, neutral, negative? The core questions we really wanted to get answers to were, how would you like to see MND research improved? And how would you like to be involved in progressing MND research outcomes? So ways patients would like to see MND research improved were more funding. We'd all like to see that, but also better trial inclusion for both patients and genetic carriers, and better improved experience while they're in the trials and afterwards, better communications. And how would our participants like to be involved in progressing our outcomes? One is obviously 80% said to participate in trials, but people are also keen to be helped in development of those studies and also communicating the outcomes of those studies. Next slide. Right, so who actually came to the summit? We had about 50 people in total, and that included obviously people with lived experience. We had a large cohort of people, that's patients, carers and ex-carers. Had researchers across the spectrum, lab, medical, allied health practitioners, as well as social science and care. Research funders were there as well, both from government. We had philanthropists and charities such as FightMND and MNDRA. We also had care delivery providers, the state associations represented, and we have industry representatives. Biogen were there as well as another company, Cell Therapies. And importantly, we also heard from other disease collectives. So from MS, dementia and obesity have all engaged in collaborative efforts across their whole disease spectrum. So the documents we put together, the draft for the summit, well, it was our purpose to create hope and improve the lives of people living with MND. Our 2030 10-year vision was to collectively drive development and delivery of effective treatments and person-centered care for people living with MND. The values were making sure we had a strong MND voice. We need to collaborate. We need to make sure we have impact. It's urgent, and we have to provide care across the whole community, access and equity for all. The scope of the summit was very important to define. The scope is to catalyse a collective approach to research that enables better outcomes for people living with MND. We needed a 10-year vision, we define outcomes and a 12-month plan to get that started. The key objectives to get from the summit were how we're going to work together with people with lived experience. We need high-level governance models, and we need to work out how we're going to engage across the whole MND research ecosystem. We need to build our draft 12-month roadmap. We need clarity on the next steps and also ownership of who's going to do what to make sure we maintain that momentum. So the summit program, I'll briefly skip through this. Basically, first day, it was 2 half days from 12 till 5:30 the first day and from 9 till 2 the next day. Having the overnight gave us a chance to refresh, and also putting in one day would be a very long day and we'd lose quality by the end of it. So first hour of the day was really understanding the voice of lived experience. Here we broke up into groups and heard from people living with MND, and we got to discuss that to really put everyone on the same page. We then got to discuss the draft purpose, vision and outcomes. We then heard from the various collectives, both from obesity and dementia outside of MND, and also from within MND, from Matthew Keenan and Brad Turner. We then started to discuss what is our collective vision look like for success? What is a collective in MND going to look like? And that was the close of the first day. The second day, we heard from Liz Cameron-Smith, a director at PwC, about how you build a collective, what happens in the first 12 months. We then started to discuss how we can build those foundations, discussing things like governance, stakeholders, the ecosystem, what big ideas can we bring into it. We had a couple of sessions on that. And then we actually broke out to build the 12-month plan to really get into specifics about what we need to do. And finally, people got a chance to discuss how they would like to be involved and how they could contribute to this. And finally, myself and Murray Gill, who is a person with who's a patient living with MND, closed off the meeting. So what actually came out of the meeting? It's only happened a couple of weeks ago, so we still haven't formalised a document for that. But some of the key learnings and outcomes were clear. It was important early on to emphasise that the focus of the summit was specifically on research, and also to step away from defining specific research area priorities. We weren't trying to say one area is more important than the others. We had really strong engagement across the two key themes of to establish a collective and also to put the lived experience at the heart of all our research. That was really important, and we're really happy to see that. Defining clear 12-month goals was critical. That came out very clearly. And also we need a governance structure. There was really good advice there from the other collectives, such as Dementia, who said you've got to put things in place up front to make sure you can run this properly. We've got to build on our collaborative efforts and work with the current programs and not trying to replace or take over anything. And we need to identify some early wins, such as put in infrastructure resources to better communicate our research outcomes, and also establish a formal framework to allow us to better engage with the Plex community. And finally, what are the next steps? We're going to produce and distribute the formal summit report and outcomes. That hopefully will happen in the next week or so. We need to maintain engagement with all the summit participants and also broaden that engagement. Identify a working planning group, much like the design group, to move forward to really put into place how we can establish this collective. And the most important thing is that we don't lose the fantastic momentum that we created by putting together this summit. And now myself and Beck would love to hear your thoughts and take any questions that you have. Thank you.
Thanks.
Well, thank you very much, Beck and Gethin, for this wonderful presentation with an inside view of a nationwide collaboration in Australia. And if there are any questions, there are two possibilities. You can write your question in the chat so everybody can see your question, or you can raise your hand and if you click on participants. So I would now like to open the floor for questions or things that people like to know from this fantastic journey that they are on. Give it a few more moments for everybody, because it's of course the first session, so everybody has to get used to it. It feels like a very clear and good presentation from both your sides, Beck and Gethin. And
thank you. I can see there's a question up there from Rod Harris, I think. Rod's just asking, will a research program include research into care and support services? We certainly hope so. Even though we won't be, it's not care provision, we will be, if there's research into care, then we're more than happy to support that within this. The idea is you should support research right across the spectrum. We don't want it to be exclusive at all.
Great. Somebody else, maybe in the chat, the raise hands. Beck, if you could, for me, phrase out one thing, what is the top and what is the tip of the process? I'm not sure Beck is in there.
Yeah, I'm not sure if Beck's logged on or not. I can't see her on the list.
Go ahead, Gethin.
Yeah, so what's how do you mean by the top of the process? Do you mean the first things we want to sort of move
what is,
with, or?
if you would, for somebody else who would like to do this, what is the thing that you really got out of it on a personal side, and what is the tip, what you say, if you look back, could be better?
Okay, yeah. So what was really satisfying was the level of engagement we got across the MND community, and that's like right across the board, researchers, obviously funding bodies, me and Beck represent those, but we got engagement with the national funding bodies, with the care associations. Everybody seemed very keen to be involved. And I think because we did shy away from trying to define specific research areas that we would focus on, that keeps people engaged and stops a real source of potential friction. I think it was clear that we established that very early on, that we didn't want to say genetics research is a priority, or cell models, mouse models, etc., because you put 20 researchers in a room and you'll come out with 20 different priorities in that. I think obviously these people are very committed and everyone thinks their research is a priority. So what we want to do is create a framework to facilitate all forms of research as efficiently as possible. Ultimately, I guess we'd like to be able to use this to leverage the government for significant funding. That would be our ultimate aim, but to get first, we have to get everyone engaged and on the same page. So the tip is, I think, It also helps if the two major funding bodies are there at the table together, because that really encourages people to come to the table, I think. So I think, to stay away from the divisive measures in the first place, and I think that's really important. So to make sure you're inclusive rather than trying to pick who you want to be there. Just invite all aspects of the research, even the people that perhaps, you might call them troublemakers, but then you invite them because they're the people with the ideas that challenge you.
Well, thank you very much, Gethin. There was a question from Sally, but you already answered it, so that's great. And so once again, very big thanks to you both for the presentation and sharing this great initiative.